Hello, this is Stephanie Hates again. I think you know my face by now. I'm doing the respiratory video. So again, have my American Girl doll, no real willing participants, and I think this would be a little too much to try and do with the little one. So come in the room. Hi, my name is Stephanie. I'll be your nurse today. I'm going to be performing and assessing performing an assessment, an evaluation of your respiratory system. Is that okay with you? Yes, hopefully. During that time, I would be washing my hands, pulling the curtain when I first walk in the room, giving some privacy. And then I would right away look at the armband. Can you confirm for me your name, date of birth? Make sure that matches. And then 2 questions are going to be, do you have a cough? Do you have a history of cough? Do you have a history of asthma? Do you have asthma? Any respiratory illnesses? Family history of respiratory illnesses? Family history of asthma? All different things dealing with the respiratory system. And I forgot to note at the beginning of this video, so I apologize if my phone does ring. Right before I started this, I got a phone call that my grandpa, who's in the hospital, went up to the ICU with a central line and blood pressure meds. So I will have to take that phone call if it does happen. Hopefully I can just pause the recording. I just want to let you be aware of that while I go through this. Okay, so obviously she's not a patient in the room, but I can say that, I would be looking in to see if she was sitting, if she was relaxing, if she is slouched, if she looks like she's, doing some labored breathing, red or blue in the face, just kind of examining what position she's preferring to be in, if she does have pain, is she like hunching towards it or things like that. I'm also going to be looking at her facial expression. Is she panicked? Like she can't get breaths in? She's short of breath? Is she relaxed? Grimacing for, pain or shortness of breath. And then I'm going to also evaluate her level of consciousness. So I would be asking her, the patient, just some basic questions, like orientation questions, I would say probably, and seeing if she's able to respond appropriately, but also, if I say her name, is she going to be open with her eyes? Is she going to be looking at me? Is she able to, take in that question, process it, and give me an answer? Do I have to sternal rub her to get her awake? All varying different levels of consciousness, so I would assess that right away, especially if she was with her eyes closed and looks like she was short of breath. So I'm going to try, like she's little, so I'm just going to be pointing to it. I do for this assessment, you want your stethoscope, but I realize from the heart one that this is just like way too big to be going around her. So I forgot to mention that this is something I would have. Along with gloves, again, if there's some open wound or something like that, then I would have that. But that would be appropriate equipment for her. So first I'm going to do her posterior. That's weird, she has like 2 little strings. And I'm going to start with percussions. So she's obviously a tiny body, but you're going to want to put your fingers over the area and tap and listen for what you're hearing. If it's sounding dull, if it's in panic, or if it's just normal sounds. So this did I misspeak? I said palpation and I did percuss. Okay, so percussion is one of them too. So that's what you do. There are mid-clavicular, trying to say clavicular, mid-clavicle. There are 1, 2, 3 spot. I'm a little off on that. Okay, sorry. I'm just, trying to do the best I can. And then there's like a 4-pack down here that you percuss, you listen to, just feeling all of that. And generally you can use those same 4 points for percussion and oscillation. I believe I pronounced that right. So, you listen to one side, compare it to the other, listen to one side, compare it to the other, listen to one side, compare it to the other, and then listen to those 4 areas and compare them as well. You want to make sure it's the same bilaterally. And listen for really any changes where something might be hollow or where there might be dense tissue mass. Then another thing is palpation. So she has way too little of a back, but you put your palm and you put them together on it. Picture it's a bigger person. Put them together on their back. It's like if the person was looking at you right now. Put it on the back. And just have them do a deep breath. And see if it's symmetrical when they are breathing and that their chest goes up. One other thing is to also do no, I can't remember the word. This is why I hate nominal aphasia. You have them say 99 and percuss and feel if you can feel it. That is also with your hands. You're going to want to use like where the palm starts. You're going to have it in the same spot as well. So I'd probably do that at the same time, but I would probably move my hands a little bit to hit right here. Have them say 99. You'll feel that vibration. You want to make sure that it is equal bilaterally. And if there is, more vibration, less vibration in one or the other. So palpation as well, just feeling around. You can feel in those same spots, the 3 and then the 4 box down here. Sorry, you can't even see that. You're looking for lumps, masses, tenderness. Really, you would just be asking them if it's tender. And then with the back of your hand, you want to feel temperature as well. Is there any place that's warmer than the other? Is it moist, the skin, dry? Always going to be using the back of your hand. I think that's really it for posteriorly with her. I did mention oscillation, right? Listening to it. Listen to one compared to the other. Listen to one compared to the other. Again, mid-clavicle, in between the rib spaces, which is very important. intercostal space. Intercostal space. It'll come to me. This is not a working brain tonight. So now anteriorly in the front, we are going to do the 99 as well. And again, I cannot remember the freaking terminology for Midas. Something for Midas. It'll probably come to me when I'm done with the video. Anyway, so we want to do that in the front as well. And I asked the nurses too. I was like, okay, so I'm watching like these diagrams, but like in real life, what do you do with a boob? Like, because it's right in that area where you want to listen to. So they're like, just don't do a cupping or a sexual kind of thing. They said they literally just lift it up with the back of their hand. And then again here, you're going to have your hands. She's a little tiny. Out like that. Under the breasts of both the male and female, but the female may, be different where you have to lift a little bit. So again, putting it there, feeling that vibration when they say 99, making sure it is equal bilaterally. I realize I'm looking at the screen. I'm not actually looking at the camera. Sorry. And then the same with the front. So there is going to be a 3 spot and a really good marker, honestly, is like a nipple. You want to be mid-clavicle again, but you also into those 3 spots, and then below the nipple, like under the boob, breast, sorry, should be using medical terminology. There's 3 spots, one inner, one outer, and one kind of between. So these you can, again, percuss, listening, what sounds you're getting back, palpating around, making sure there is no masses again, lumps, inspecting for lesions, looking at the color. You do the same all over. Looking to see if you can see like a lump, then also feeling it. Always back a hand for temperature, moisture. I see them a lot. And this again would be done auscultation as I get my stethoscope, but it's too little. So you go one side, compare it with the other. These are going to be really, by the clavicle, right below where you're listening. Go in intercostal spaces again, so you can hear the lung. You're not hearing through the bone or hearing the bone. Not that you can really hear bone, but hearing through the bone. And then it's the 1, 2, 3, and then under the boob, the little triangle that I showed, the like mid spot, going out more, and then going down between them. Tactile for Metis. Did it before the video ended. Perfect. So some of the things while I'm on that subject, feeling, like I said, you want them to be equal bilaterally, but if you do feel a difference, it can be a sign of, just when you're percussing too, be a sign of fluid, more dense lung tissue, mass, which would be more dense lung tissue. And then sometimes, I think that's it. I don't know where I was going. You also want to put your hands, again, in that shape, not only for the 99 where you're going to want to feel it here, I said the 99, tactile fromentus. But also, again, like we did on posterior, forgot to do it right away on anterior, you're going to want to make sure that your thumbs rise the same amount when they're breathing. So you want to feel for that as well. Symmetrical expansion of the lungs. When you are listening posterior, anteriorly, you want to listen for crackles, stridor, any wheezing, and diminished breath sounds. So I already went over the spots where you do it. I'm just kind of now saying what you want to look for as well. So one other thing, or a few other things. Bronchoscopy is hearing the person talking, but through their lungs. So when you're listening, auscultating, you can ask them a question, and then that's the way of doing that at the same time as well. Seeing if you can hear what they're saying or not. If you can hear it loud, which is positive, result is, again, dense tissue and fibrosis. And then vectorology is, again, listening for that sound. It I think I read it's a little quieter when that happens. And egophony. That is when you're going to hear increased resonance when that person is speaking. So, like I said, it's kind of a neat trick to do a couple things at once, listening to the breath sounds for wheezing, crackling, diminished sounds, and then also asking them a question so you can hear how their speech resonates, and decide which one of those are. That is my respiratory video, and I hope you enjoyed it. Thank you, and you will see me again.